The fluorescent lights hum above antiseptic-scented hallways, a mechanical prayer that echoes every morning at Seattle General in Norfolk. Laura Bennett moves through these corridors with the kind of efficiency that makes people forget she was ever there, the way smoke forgets it was fire. Her scrubs are navy blue, standard issue, the pockets heavy with trauma shears and a penlight she keeps clicking on and off during idle moments, a habit from somewhere she doesn't talk about. Under the left cuff of her sleeve, rope-burn scars track across her forearms in parallel lines. Under her left clavicle, a puckered bullet wound the size of a dime pulls the skin tight when she reaches for high shelves. She reaches anyway. 6 tours in the Hindu Kush. 3 before the operation that got classified and buried so deep that her records now say she never held the rank of captain, never commanded a field surgical unit, never learned to perform a thoracotomy with a combat knife while rounds were still coming in. Those 6 years are gone. Officially, Laura Bennett has been a registered nurse for 18 years and never been anything else. She doesn't correct people. Correction requires explanation, and explanation requires words, and words are how people find out what you're hiding. The cardboard box under her locker in the break room contains exactly 4 items: a cracked coffee mug with the logo of a unit she can't name anymore, a dying succulent in a ceramic pot she hasn't watered in 2 weeks, a photograph of her son in marine dress blue standing in front of a flagpole at Camp Lejeune, and a folded piece of fabric no bigger than a playing card. The fabric is tan with a black arrowhead and scrollwork underneath, the unit patch from the 3rd Battalion, 5th Marines. She touches it every shift change. Her hands move from the locker door to the patch to her chest, right over her heart, a 3-second ritual she performs whether anyone is watching or not. This morning she performs it at 5:27 a.m., before the fluorescent lights fully buzz to life, before the first doctor arrives, before the day becomes a series of things she didn't choose and responses she learned not to give. The hospital wakes at 6:15 a.m. Shift change bells chime through the ER. Nurses arrive in clusters, their badge IDs clipped to lanyard clips, their hands already reaching for coffee from the break room dispenser before they've said good morning to anyone. Laura is already at the main nursing station by the time they arrive, her hands moving through instrument trays with a precision that looks automatic and is anything but. She counts gauze packs. For X for S, 2x2S, abdominal packs. Her fingers know the weight of them, can arrange them by size without looking. She arranges them anyway, looking. The work requires nothing from her mind but allows everything from her body. Muscle memory does the counting while the rest of her watches the hallway, tracks the arrivals, notes which doctors are irritable and which are running late. Dr. Pierce arrives at 6:43 a.m., his Rolex catching the fluorescent light as he dismisses her med count with a wave of his hand. He's already talking to Dr. Zhao about a golf course in Scottsdale before he fully enters the nurse's station. A gold wedding band on his left ring finger, a pinky ring on his right hand, teeth whitened to an almost aggressive brightness. His voice carries the particular timbre of someone who has never been told no in a way that stuck. "Morning, Laura," he says, and the name comes out like a dismissal, like something to get through on his way to actual conversation. She nods. Her mouth stays closed. Closing her mouth is easier than opening it. Opening it requires her voice, and her voice carries something in it now that she can't quite hide, something that sounds like command even when she's asking for the time. The ER remains quiet through the morning hours. 2 MVAs, one elderly woman with chest pain that resolves on aspirin, a kid with a skateboard injury and a likely fractured radius. Laura moves from bed to bed with a kind of presence that makes monitoring vitals feel less like medical necessity and more like invisible care. She doesn't rush. She doesn't hover. She simply appears when the monitor's alarm, her hands already moving before anyone calls for her, her eyes reading the rhythms on the screen with a fluency that comes from knowing what catastrophic failure looks like, what the difference is between a salvageable crisis and a final hour. At 8:34 a.m., the doors from the ambulance bay whoosh open. The sound of a stretcher, the rapid fire of paramedic report, the metal wheels squeaking across tile, these sounds have a particular urgency that makes the ER shift its attention like a school of fish recognizing a predator in the water. Laura's hand still in the medication drawer as she's been restocking. The report comes through crisp and precise. Master Sergeant Cole Rains, 34, bilateral blast injury, partial hearing loss, deaf in left ear, significant hearing degradation right ear. Nonverbal except for basic sign language. Responsive to stimuli. Vital stable. ETA 2 minutes to trauma bay 3. The stretcher rounds the corner. The paramedics are moving fast, not panicked fast but purposeful fast. The patient on the stretcher is lean in the way that only comes from 8 years of active combat, his left side wrapped in compression bandaging, his eyes tracking the ceiling lights as they pass underneath them. His jacket, a standard military-issue coyote brown jacket, is draped across his chest. And on the inside lining of that jacket, visible for exactly 2 seconds before the stretcher enters trauma bay 3, is a patch. A faded tan patch with a black arrowhead and scrollwork underneath. The symbol of the 3rd Battalion, 5th Marines. Laura's hands stop moving. Not figuratively. Her hands, which have been arranging medications in alphabetical order for the past 40 minutes, come to a complete stop above the open drawer. Her breath doesn't catch. Her face doesn't change. But her hands stop, and that's how you know something fundamental has shifted, when the body registers something the mind hasn't yet fully processed. She touches her chest, right over her heart, where the same patch sits folded in her locker, and for the first time in 3 years, she moves toward something instead of away from it. The trauma bay fills quickly. Nurses converge like planets drawn into orbit. Dr. Pierce arrives first, his stethoscope already around his neck, his authority already preceding him into the room. Laura stands at the entrance to the bay, watching. She watches the way Pierce's eyes evaluate the patient, watching the micro-expression of calculation. Is this worth his time? Is this patient salvageable? What's the liability on a case like this? She watches Dr. Zhao arrive next, followed by Dr. Patel. The 3 of them stand at the foot of the stretcher, and Laura watches their faces the way a field surgeon watches vitals, reading what's underneath the surface, understanding what comes next before it's spoken. She doesn't yet know that 5 doctors will refuse this patient. She doesn't know that Pierce will invoke communication barriers as though deafness is a contagion he might catch. She doesn't know that Zhao will claim her schedule is full, that Patel will say the hospital lacks proper ASL resources, that Morrison will declare the man's PTSD unmanageable, that Reeves will simply walk out without speaking. She doesn't know any of this yet because it hasn't happened. What she knows now is the color of that patch, the fact that it sits inside a jacket worn by a man who carries the same unit symbol her son carries on his shoulder. What she knows is that her hands have stopped moving. What she knows is that something buried 6 years deep is about to shift. The paramedic finishes his report. The patient's eyes move toward the door, scanning for something. Looking for something. And what happened next didn't just change the morning, it changed everything that came after. The exam room fell silent when Dr. Pierce walked in. Master Sergeant Cole Raines sat on the edge of the bed, his daughter beside him with her phone open to a translation app, her fingers poised over the keyboard. Pierce didn't glance at either of them. He read the chart, his jaw tightening as if the words themselves smelled bad, and then he looked at Raines the way a man looks at a broken vending machine, with contempt and inconvenience. "I don't have time for charades today," Pierce said, his voice carrying the particular cruelty of someone accustomed to being obeyed without question. Raines's hands lifted. His fingers moved in clean, precise signs, a question about his labs, about timeline, about what came next. The question hung in the air like a prayer no one was listening to. Pierce turned and walked out. The door swung shut behind him with a soft click that sounded like a verdict. Raines's daughter stared at the closed door, her face flushing a dark, humiliated red. This was the 4th refusal in 90 minutes. Dr. Zhao had been first, her surgical schedule suddenly full despite the opening in the log, a cancellation that appeared in the system exactly 4 minutes after Raines's intake. She'd stood in the doorway while Raines's daughter attempted to communicate through the translation app, watching the slow text-to-speech voice read her questions aloud. "Not my specialty," Zhao had said, turning to leave. When Raines's daughter asked if she could refer someone, Zhao didn't answer. The question dissolved into the empty hallway. Dr. Patel had arrived with a clipboard and the suggestion of a transfer. The hospital lacked proper ASL resources, he'd explained to Rains, as if the veteran couldn't understand perfectly clear English spoken directly at him. We have facilities in Seattle better equipped for your needs. Not asking. Informing. The implication that Rains's presence here was the problem, not the doctor's refusal to communicate. Dr. Morrison had lasted 7 minutes. A tray had clattered to the floor outside the exam room, and Rains had flinched, the involuntary response of someone whose body remembered things his mind tried to forget. Morrison had watched that flinch like a predator watching prey show weakness. PTSD makes him unmanageable, he'd announced to the nurse's station as he left, his voice pitched loud enough for Rains to hear through the thin walls. Can't have that kind of instability on the floor. Dr. Reeves had simply read the chart and walked out without explanation. No greeting. No eye contact. Just the soft sound of a man deciding that this patient wasn't worth his time. 5 doctors. 90 minutes. A military veteran with a hearing loss and a family desperate for someone, anyone, to treat him like a human being. Laura Bennett was at the medication cart when Rains's daughter found her, the girl's eyes rimmed with tears, her voice breaking over words she'd had to rehearse through an app. Please. He's in so much pain. He doesn't understand why no one will. She stopped, unable to finish. Laura set down the medication bottle she was organizing. The pharmacy labels read in alphabetical order, the cap colors visible in a gradient of reds and blues and clear, small order in a room designed to break people down. She turned, and for the first time since Rains had arrived at Seattle General, her eyes met his directly. She didn't speak. She signed. Her hands moved with the fluid precision of someone who had spent years learning a language not for a job requirement but because it mattered. The signs were clean, authoritative, her face open and direct. I will coordinate your care. You won't be alone. That's a promise. Rains's jaw tightened. His eyes, one brown, one milky with scarred tissue, locked onto hers with the intensity of a man recognizing a language he thought he'd lost. His hands lifted slowly, his fingers shaping a response. How do you? The moment crystallized and then shattered. Nurse Bennett. Dr. Pierce's voice sliced across the hallway like a blade. He stood at the nurse's station with Rains's chart open, his smile the smile of a man who'd just found leverage. A word. He didn't wait for an answer. He turned and walked toward the supply closet, the unspoken command clear in the angle of his shoulders. Laura glanced at Rains, her expression unreadable, and followed. Pierce closed the supply closet door. The space was barely large enough for 2 people, lined with boxes of gauze and for tubing, the fluorescent light casting everything in a clinical pallor. The smell of antiseptic was thick enough to coat the throat. You're not a doctor, Pierce said. His voice was quiet now, which made it worse. Quiet voices in small rooms carried weight. No, Laura said. And yet you're promising this patient medical care outside your scope of practice. I'm offering communication support. You're overstepping. Pierce stepped closer. He was a tall man, built the way administrators often were, gym-sculpted and tailored, his badge clipped to a pressed white coat that probably cost more than Laura's entire scrubs rotation. He used his height the way predators use size, leaning into her space. Tell me, where did you get your medical degree? Which school was it? The supply closet air went thin. Because I checked your file, and I found something interesting, Pierce continued, his voice dropping lower. No degree. No specialty certifications. Just a registered nurse diploma from a community college, and even that's from what, 6? 7 years ago? You've been pushing pills and changing bedpans for how long now? And you think you can treat my patients? He waited. The silence stretched like taffy. Laura raised her eyes to his. Her jaw was tight, not with fear, but with the kind of controlled fury that comes from having survived things that would break most people. She waited until she saw sweat bead at his hairline, until the silence became so heavy that he shifted his weight to break it himself. When she spoke, her voice was flat and cold and could have frozen blood. I've seen braver men run from less. She turned and walked out of the supply closet, her spine straight as rebar, and returned to the medication cart as if the conversation had never happened. Pierce stood alone in the small room, surrounded by boxes of gauze, his hands forming fists that he had to consciously unclench. The next morning during rounds, he found his moment. Laura was explaining Raines's vitals to the resident, blood pressure stable, O2 saturation 98% on room air, heart rate in the 70s, when Pierce approached with 4 nurses trailing behind him like remoras behind a shark. Raines's daughter sat in the corner chair, her phone ready to translate. "Nurse Bennett's numbers seem off," Pierce announced, loud enough that every person on the floor heard him. He tapped the chart. "She's got him on 400 milligrams of ibuprofen every 6 hours. "Standard dosing?" "Yes," Laura said. "For a 185-pound male with renal function, let me check, at baseline." Pierce looked up, his smile knife-sharp. "Are we sure Nurse Bennett can count that high?" One of the trailing nurses made a small sound, quickly suppressed. Raines's daughter's hands trembled as she typed something into her phone. Laura didn't flush. She didn't stammer. She met his eyes with that same flat stare and said, "Calculations are correct. Next patient." She walked past him toward the medication cart, her movements precise and unhurried, as if he were furniture she'd learned to navigate around. Pierce followed her, his voice dropping to something only she could hear. "You're making a mistake, Bennett. I'm trying to help you see that you're not equipped for this level of care." "I'm equipped for what he needs," Laura said, not turning around. That afternoon in the break room, she sat with her lunch, the container of rice and vegetables, arranged with the same careful order she applied to medication bottles, and watched the other nurses carefully not look at her. When she pulled out a chair at their table, there was a moment of pure, crystalline silence. Then 4 nurses stood simultaneously, their chairs scraping against the tile floor with a sound like fingernails on chalkboard, and moved to different tables, their conversation resuming as if she'd never existed. Laura ate her lunch alone. She didn't eat faster. She didn't eat slower. She simply ate, her hand steady, her face composed, the way someone eats when they've learned long ago that showing reaction to hunger is a vulnerability that gets exploited. By late afternoon, a typed notice appeared on the unit board, pinned at eye level where no one could miss it. Disciplinary write-up. Insubordination and procedural violations. Nurse L. Bennett. The allegations were vague enough to be damaging and specific enough to be documented: failure to follow chain of command, unauthorized patient care coordination, challenging physician authority. Dr. Pierce's signature was at the bottom, initialed in blue ink with the kind of flourish that suggested satisfaction. Laura read it once. Her jaw tightened. Her hands, checking a patient's for line 3 minutes later, remained rock steady. She was in Raines's room at 1900 hours, updating his chart, when his hands lifted. His fingers moved slowly, questioning. The signs were uncertain, like someone dusting off a language they hadn't used in years. He was asking about her hands, the way she signed, the efficiency of her movements, the muscle memory that came from somewhere deeper than nursing school. Laura's fingers froze mid-notation. Her pen hovered above the chart. Raines's hands finished the question, VALKYRIE. The air in the room changed pressure. Laura set down her pen with deliberate care. Her hands wanted to respond, wanted to confirm what his recognition implied, what that Marine unit patch inside his jacket probably meant, what her son's last letter about his new CO had suggested before she'd stopped reading letters and started forgetting the person she used to be. She made an excuse about medication rounds. She left the room while Raines's hand still hung suspended in the air, waiting for an answer that might expose everything that was supposed to stay buried. In the staff bathroom, she gripped the edge of the sink and stared at her reflection under the fluorescent lights. The woman in the mirror was the woman who'd learned to disappear: no rank, no history, no identity beyond bedpans and vital signs. The operation stays classified. The records stay erased. You surface for nothing. But Raines had walked into Seattle General wearing the insignia of a unit that fought in Helmand Province. And the last time Laura Bennett had heard that call sign, Valkyrie, she was pulling a bleeding Marine out of a collapsed compound with Taliban bullets punching through the walls, and her hands had been moving with the certainty of someone who'd been trained to save lives in the dark. Her son's commander. Her son. The implication spiraled outward like concentric circles, each one expanding into dangerous territory. Pierce was already building a case against her. If she acknowledged anything, if she let anyone know that she recognized something in Rains, the whole structure could collapse. And yet, she'd learned a long time ago that some things were worth more than disappearing. Dr. Patel arrived at 2:30 that afternoon, her surgical mask already in place before she entered the exam room. Laura stood beside Rains's bed, a tablet displaying his admission paperwork, and Patel's eyes swept past both of them without stopping. Communication barrier, Patel said to no one in particular. The hospital lacks the proper ASL resources for a patient with this presentation. I'm going to recommend transfer to a facility better equipped for. Laura's hand rose slightly. A single gesture. Patel's jaw tightened. She turned and left without finishing the sentence. That was the third refusal. Dr. Zhao had cited her surgical schedule. Dr. Pierce had walked out of the consultation with his dismissive smile still burning in Laura's chest like a warning flare. But Dr. Morrison was the one who broke something in the room's atmosphere. He stood in the doorway at 3:15, and his voice carried the particular cruelty of a man who'd never been questioned in his life. The PTSD makes him unmanageable, Morrison said, gesturing at Rains as though the veteran couldn't read lips, couldn't see the condescension written across his face in neon. Deaf and traumatized. He's a liability. I won't risk my team's safety. Laura felt her chest expand with the kind of breath you take before you say something you can't take back. She held it. Waited. Pressed her tongue against the roof of her mouth until the words dissolved like ash, and Morrison left satisfied that he delivered truth. The fourth refusal stung less only because she'd stopped expecting anything else. Dr. Reeves didn't speak when he entered. He glanced at the chart, looked at Rains's face for exactly 2 seconds, and walked out without explanation. No excuse. No courtesy. Just silence and the soft closing of a door that said everything. This patient is not worth my time. 5. That was the number that mattered now. 5 doctors had looked at a master sergeant in the United States Marine Corps and found him disposable. 5 decisions made in moments that would echo through the next 72 hours like shrapnel through soft tissue. Laura sat at the nurse's station at 4 o'clock and pulled up the billing system. Something had been bothering her since Pierce's first appearance, the way his dismissal had been delivered with such certainty, as though Rains's fate had already been decided before the morning briefing. She scrolled through the phantom consultations. Cardiology consult, billed but no notes documented. Pulmonology consult, charged at $1,200, no treatment plan attached. Neurology consult, 3 separate charges, each to a different code, each routing through subspecialty billing where the kickback algorithms ran their quiet mathematics in the background. The pattern was clean. Professional. The kind of fraud that only worked because it hid inside legitimate paperwork, camouflaged by the noise of actual medicine. Pierce wasn't refusing Rains because of communication barriers or scheduling conflicts. He was refusing Rains because a patient with proper documentation, with witnesses, with a clear billing trail, might ask questions that led to audits, and audits led to the kind of federal investigation that ended careers. Laura closed the tablet. Her hands were steady. The trembling wasn't fear, it was the kind of restraint that came from knowing exactly what she was about to do and understanding the cost with crystalline precision. The break room the next morning smelled like burnt coffee and the particular staleness of a space where people arrived only to leave. Laura sat at the single plastic table with her lunch, a sandwich she wasn't going to eat, and watched the room fill. The first nurse through the door stopped mid-stride. The second one turned and left. By 9 o'clock, the break room had developed a new geography, anywhere Laura wasn't sitting. It happened fast. The kind of coordinated isolation that could only come from a single source, a word in the right ear, a memo sent at the right moment, a simple suggestion from someone with authority, this person is a problem. Dr. Pierce had moved to stage 3. Not crude social attacks anymore. Strategic engineering. He'd infected the staff with doubt the way some people spread colds, a cough in the common areas, and by evening, everyone's lungs were compromised. Laura watched them choose seats that kept her in peripheral vision, watched them leave their lunch half-finished when she sat down, watched the tiny mathematics of avoidance play out with remarkable consistency. The disciplinary write-up appeared on the unit board at 10:15. Laura saw it while passing the nurse's station, her eyes catching on her own name in Pierce's precise handwriting. Policy violation. Insubordination. Procedure 7.3.2. Scope of practice: nurses shall not undertake interventions outside their designated authority without explicit physician orders and documented justification. The language was surgical. It didn't accuse her of anything specific because it didn't need to. The document created a frame, and any action she took in the next 72 hours would be interpreted through that frame. Unilateral. Unauthorized. Dangerous. Laura pulled the write-up from the board and carried it to the supply closet. Not to cry. Not to fall apart. To read it carefully, to understand exactly how Pierce was constructing his case, to see the architecture of the trap he was building. Hospital Policy 7.3.2 was written in the language of protection, patient safety, liability management, standard of care. What it actually said was, know your place. She folded the document into her scrub pocket and returned to the unit. By noon, the isolation had deepened into something almost physical. Laura moved through Seattle General like a ghost, present but not acknowledged, a person the hospital had decided didn't quite exist. She checked on Rains, updated his chart, noted the subtle changes in his vital signs that no one else seemed to be monitoring: oxygen saturation trending down, respiratory rate climbing. The kind of deterioration that happened slowly enough to miss if you weren't looking. That was the real trap. Not the disciplinary write-up. Not the staff's coordinated withdrawal. The trap was Rains himself, a patient deteriorating on Pierce's watch while Pierce had made himself impossible to reach. The afternoon shift change came at 3 o'clock. Laura stood at the edge of the unit and watched the staff rotation, the careful way Pierce had positioned himself as untouchable. He had allies now, the residents who'd been warned not to contradict him, the attending physicians who understood the politics of the hospital well enough not to ask difficult questions, the administration that protected its own because protecting your own was how you survived. The fluorescent lights above hummed their electric prayer, and Laura felt something shift in her chest, not fear, not frustration, but the kind of focused clarity that came from having already made the decision. She'd spent 6 years in the Hindu Kush learning what happened when you followed the rules and watched people die anyway. She'd learned that some protocols were designed to protect institutions, not people. She'd learned that there were moments when you stepped outside the law because the law had already stepped outside of humanity. 3 days. Pierce had given her 3 days to watch Rains's condition decline, to file complaints through proper channels that would go nowhere, to follow every procedure in Hospital Policy 7.3.2 while her son's commanding officer suffocated in a room down the hallway. But that wasn't the worst part. The worst part was that Pierce had made a calculation error. He'd assumed Laura would obey the rules because that's what civilians did. He didn't understand that she'd already broken the biggest rules that existed, she'd already killed people, saved people, and operated in spaces where law and morality existed in completely different dimensions. A hospital policy was nothing compared to the weight of a classified operation. Laura checked Rains's oxygen saturation at 4 o'clock. 91%. Trending down. She found Pierce in his office and knocked once before entering. "Master Sergeant Rains is declining," she said. Her voice was quiet, neutral, a nurse reporting an observation to a physician. Pierce looked up from his computer screen, and his smile was the thing that crystallized everything. Not contempt. Not anger. Satisfaction. "File it through proper channels, Bennett. I'm sure your nursing assessment is adequate." He returned to his screen like she'd already left. She had already left. Some part of her had walked out of that office and made the decision that would cost her everything. The rest of her stood in the doorway for exactly 3 seconds, watching a man destroy himself without knowing it, then turned and went back to the unit where Master Sergeant Rains was slowly suffocating while the system Pierce had weaponized hummed along like a perfectly oiled machine. By evening, his oxygen saturation was 88%. By midnight, it would be 80%. And Laura Bennett, who had once held the rank of captain in special forces, who had learned to operate in spaces where rules were the luxury of people who didn't understand how the world actually worked, would have to choose between following protocol and letting him die. She already knew which choice she was going to make. By the end of day 2, Rains's breathing had changed. Laura heard it the moment she entered his room, that soft, whistling quality underneath the supplemental oxygen, the sound of airways narrowing like a fist slowly closing. Strider. The kind of noise that meant something was compressing his airway from the inside, and every breath was a negotiation with his own body. She'd heard it before in field hospitals where swelling went untreated, where the body's own inflammatory response became the enemy. She checked his chart. His oxygen saturation had dropped from 94% to 87% despite the high-flow nasal cannula. His daughter sat in the corner chair, eyes locked on the monitor as if she could will the numbers upward. Laura didn't hesitate. She paged cardiology first, Dr. Patel's service. The call went to voicemail. She waited. Called again. Voicemail again. She left her name and extension each time, her voice level, professional, knowing that voicemail meant busy, meant he'd get back to her within the hour. Except voicemail also meant plausible deniability. She paged respiratory therapy next. Nothing. Not a callback, not a text, not the courtesy of a return page. She waited 12 minutes and tried again. The phone at the respiratory desk rang and rang like a go signal in an empty room. She could see them from Rains's door, 3 respiratory therapists gathered near the supply closet, talking. They saw her. They didn't pick up the phone. One of them turned away slowly, deliberately, the kind of choreographed dismissal that required effort. Laura called Dr. Pierce's office directly. His administrative assistant, a woman named Margaret who usually liked Laura, who used to save her a cup of coffee on bad mornings, answered on the first ring. Seattle General Cardiothoracic, this is Margaret. Margaret, it's Laura Bennett. I need Dr. Pierce. I have a patient seizing into respiratory distress. He's in a meeting. Pull him. Code blue parameters. He said no interruptions. The line went quiet. Laura counted to 3. Margaret, I need him now. I'll leave a message. The line went dead. Laura's hands were steady. Her jaw wasn't clenched. She'd learned to release that tension years ago, learned that anger lived in muscle fibers and could be consciously abandoned, like setting down a gun. But something else happened in her chest, something that felt like the click of a safety being switched off. She looked at Rains. His oxygen saturation was at 84 now. His lips were taking on the faintest blue tint at the edges. She called code blue overhead. Announced it herself. 5 times in her career she'd done this without a doctor's authorization. 5 times the physicians had shown up anyway because the code was called and protocols demanded response. This time, she announced it again. Code blue. Trauma Bay 3. All available physicians report code blue. Nothing moved in the hospital. No footsteps. No running. No crash cart bearing down the hallway. She watched the monitor. Rains's oxygen saturation was dropping, 82, 80, 78. His body was beginning to fail the arithmetic of survival. His breathing had become a rasp, shallow and frantic, the sound of someone drowning in air. His daughter stood up. Is he? What's happening? Stay back, Laura said quietly. Not harsh. Just a statement of fact, the voice of someone who had seen bodies fail and knew the choreography required to stop it. Rains's back arched. The seizure came like electricity, his limbs locking into rigid contraction, his jaw clenching so hard she heard his teeth snap together. His tongue fell backward into his airway. His oxygen saturation collapsed, 70, 65, 60. The monitor's alarm became a sustained shriek. His brain was dying in real time. Every second his neurons were being starved of oxygen. Permanent damage began at 4 minutes. Brain death at 6. She had 90 seconds before the point of no return. Laura moved to the supply cart. She didn't run. Running was panic. Running was for people who hadn't operated under fire with rounds passing close enough to feel the pressure change in the air. She opened the sterile field. Alcohol prep. 10 seconds for scrub. Her hands moved like they were disconnected from thought, muscle memory that had calcified in the Hindu Kush, in field hospitals where surgeons became what the situation demanded. She found the cricothyroid membrane by touch alone, the space between the cartilage rings in his neck where the airway was narrowest and the access most direct. Her thumb found the landmark. Her other fingers splayed to define the space. The folding knife was in her pocket. She'd carried it for 17 years. 3 inches of surgical steel that had saved lives in places where surgical instruments were luxuries. She flicked the blade open. The sound was soft, almost musical. She didn't hesitate. The blade penetrated the membrane with controlled pressure, not a slash but a precise vertical incision through tissue layers she could navigate in the dark. Cricothyroid membrane. 2 millimeters of depth, no deeper. Through. The hiss of air escaping. That was the sound that meant she'd found the airway. That was the sound that meant Rains would live. She had a 6.0 endotracheal tube in her other hand. She'd prepared it while moving, her fingers gathering supplies with the efficiency of someone who had done this before in conditions that made this look like a simulation. She threaded the tube through the opening. Felt the resistance give. Felt the tube slide into position. Breath sounds bilateral, left and right. His oxygen saturation climbed, 40, 50, 60, 70. Sinus rhythm. Normal. The entire procedure took 48 seconds. She secured the tube with tape while his daughter sobbed, the kind of sound that came from someone watching the impossible happen in front of them. Rains's oxygen saturation continued climbing. 80. 85. 90. His seizure had stopped. His body went slack, not in death but in the sudden absence of crisis. His daughter moved toward him, but Laura held up one hand, not harsh, just informative. Let me finish. 2 minutes. She verified breath sounds again. Checked lung expansion. Confirmed the placement with an immediate portable X-ray that showed tube position at 2 centimeters above the carina, exactly where it needed to be. His vitals were stable. More than stable. Normal. As if his body had simply been waiting for someone to give it permission to live. Dr. Pierce arrived 6 minutes later. He didn't walk into the room. He appeared in the doorway, and the way his eyes moved from the tube in Rains's neck to Laura's face told her everything she needed to know about what was about to happen. His expression shifted through surprise, then understanding, then something that looked like hunger. He had a folder in his hand before he came through the door. He'd been prepared for something. He'd just gotten something better. Step away from the patient, Bennett. Laura removed her gloves. Disposed of them. Wrote her notes on the chart. Didn't look at Pierce. Vitals stable. Airway secured. Oxygen saturation 92%. I said step away. She turned to face him. The room went quiet in the way that only hospitals could go quiet, that controlled silence where every breath was deliberate and monitored. Pierce's jawline had the tight quality of someone who'd just been handed the exact thing he needed to justify something he'd already decided to do. You performed an unauthorized surgical procedure, he said. Not a question. A statement. The words of someone building a record, not asking for explanation. The patient's airway collapsed. 5 physicians were paged. You're a nurse. I'm a licensed nurse with a scope of practice that includes. Policy 7.3.2 explicitly forbids surgical procedures outside the operating room environment without physician authorization. He opened the folder. Started reading from a document that she could see was already printed, already prepared. Already waiting for this exact moment. Unauthorized surgical intervention. Scope of practice violation. Insubordination. Dangerous unpredictability as a safety risk. Security appeared in the doorway before she could respond. She recognized them. Marcus from evening shift, who used to ask her about her son. Davis from the desk, who she'd helped through nursing school prerequisites 2 years ago. Neither of them would look at her. They didn't need to. They had their instructions. "You need to come with us," Marcus said quietly. Laura looked at Rains. His breathing was easy now, rhythmic, the sound of someone living. His daughter was holding his hand. The monitor showed perfect sinus rhythm. Oxygen saturation 93%. Her job was done. The crisis had passed. The patient would survive because she had chosen to act instead of wait, and now she would pay the price for that choice in exactly the way Pierce had calculated. She walked out of the room. Walked past Marcus and Davis. Walked to her locker while they followed 2 steps behind her. The other nurses were visible in the corridors, watching, and she understood that this was the moment they'd all been waiting for. The nurse who defied Pierce. The nurse who'd stepped outside the hierarchy. The nurse who'd proven that she wasn't just a nurse at all, that she was something else, something more dangerous because she had skills they didn't have and experience they couldn't understand. Her locker contained a cracked coffee mug from a deployment 7 years ago. A dying succulent that her son had given her as a joke. A photograph in a wooden frame, her son in marine dress blues, the kind of image that belonged on refrigerators in houses where people had normal lives. The faded unit patch was still in her scrub pocket. Special Forces patch, desert tan, worn soft by time and handling. The same patch Rains wore sewn into his jacket lining. The same patch her son wore underneath his marine uniform. She placed everything into the cardboard box Marcus held out to her. The box was flimsy, the kind used for printing paper. Water would destroy it in minutes. But she took it anyway and walked out of Seattle General at 6:47 in the evening while the sun was still visible behind the clouds, those last few minutes of daylight that made the rain look like it had color. The bus stop was 3 blocks away. She stood there in the rain and watched the water darken the cardboard at the bottom of the box, watched the coffee mug shift and settle as the structural integrity failed. She didn't move. Didn't seek shelter under the bus stop roof. Just stood in the rain with a cardboard box falling apart in her hands and wondered if anyone in the hospital understood what they'd done, what they'd really done, when they decided that policy mattered more than survival. The rain got heavier. The cardboard started to split. She didn't move. She didn't cry. She just stood there like someone who had already survived worse things than this, and probably had. But that wasn't the worst part. The worst part was that she didn't know yet that Seattle General's phone lines were about to light up with calls from numbers that didn't appear on regular caller ID. She didn't know that Dr. Pierce's complaint had triggered something that would move through federal channels like a slow-motion avalanche, that his documentation had created exactly the electronic trail that would expose not just her but him, that his own words would become evidence in an investigation that was about to begin in exactly 12 hours. She just stood in the rain at the bus stop in Norfolk with a dying succulent and a photograph of her son and the faded unit patch still in her pocket, waiting for the bus to come, waiting for her life to become something else again. The bus stop shelter rattled in the November rain, metal groaning like something wounded. Laura stood inside with her cardboard box pressed against her chest, the edges already softening from moisture. Inside were 3 things: a cracked coffee mug with a Marine Corps emblem, a succulent that had stopped reaching toward light 3 days ago, and a photograph of her son in dress blues, his eyes carrying the same flat competence hers did. The rain hammered the shelter roof like applause nobody wanted. She didn't move. She didn't look at her phone. She just waited for the bus the way soldiers wait for extraction, patient, still, knowing that time was the only variable that mattered anymore. The Pentagon called Seattle General at 6:41 a.m. Dr. Pierce entered Master Sergeant Rains's recovery room at 7:12 a.m. expecting to manage a termination narrative. He expected a weakened patient, isolation, no complications. He expected the story he'd already written: unauthorized procedure, scope violation, nurse terminated, case closed. What he found was a room full of silence and a deaf veteran who looked directly at him and whispered a single word in his broken voice. A word that should have been impossible. A word that meant everything. Valkyrie. The monitors beeped their steady rhythm. Raines's oxygen sat at 94%. His airway was clear. His blood pressure had stabilized. And standing in the doorway, in the same scrub uniform she'd been escorted out in 20 hours ago, was Laura Bennett with her hand steady and her eyes carrying something that made the temperature in the room drop 5 degrees. A Marine captain stepped into the frame behind her. The uniform was dress blues, immaculate, the kind that moved through air like authority made physical. He carried a leather folder. He opened it without preamble and began reading in a voice like measured gunfire. Captain Laura Margot Bennett, decorated Silver Star recipient, credited with 17 combat saves in classified operations, Hindu Kush Theater, 2009 through 2015, call sign Valkyrie, assigned to the Special Operations Command JSOC Task Force 121 under Pentagon protective status. He paused. The silence was thick enough to operate in. Security clearance level TS/SCI compartmented. Operational history sealed. The individual responsible for Master Sergeant Cole Raines's arrival at this facility is the same individual who extracted him from an active combat zone in 2013. They share a unit patch. A blood oath. A command structure that exists outside hospital jurisdiction. Dr. Pierce's mouth opened. No sound emerged. A woman in dress uniform walked through the doors. 2 stars on her shoulders. A general officer whose presence made the fluorescent light seem cheaper. She stepped to Laura Bennett and rendered a salute, not to the nurse, not to the room, but directly to the woman standing with her hands at her sides. The general's voice carried the weight of concrete. Captain Bennett. Welcome home. Your code name is confirmed in the Pentagon secure database. Master Sergeant Raines's extraction and recovery fall under JSOC medical oversight effective immediately. This facility will comply with all federal directives regarding his care. Behind the general, visible through the window, a black Hawk helicopter sat in the hospital parking lot with its rotors already turning. 2 operators in tactical gear stood flanking the doorway. Dr. Pierce tried to speak. The words came out fractured, desperate. Hospital policy. Protocol 7.3.2. Scope of practice violations. I filed the proper documentation. The general didn't look at him. She was still looking at Laura. A Pentagon official stepped forward holding a laptop computer and read from a secure encrypted file. Dr. James Pierce, 18 months of phantom consultation billing codes, $847,000 in kickback transfers routed through 12 referral partners, 17 Medicare fraud charges pending, 12 state board violations, 2 felony health care fraud statutes violated. The official closed the laptop. The federal investigation you triggered by filing complaints against a protected operative has identified financial crimes spanning this entire facility. Your own documentation trail, every falsified consult, every inflated code, every kickback pattern, is now evidence in an active criminal investigation. The FBI has secured your office. Your computer access has been terminated. You have the right to remain silent. Dr. Pierce's hand started shaking. His medical degree had become a liability. His corner office was a crime scene. The documentation he'd so carefully weaponized against a nurse he thought was powerless had exposed him to federal prosecution. Every regulation he'd quoted had become a noose around his own neck. Laura waited until his eyes found hers. She didn't speak. She just delivered the same cold, flat stare she'd perfected over 18 months, the stare that made silence feel like drowning. Pierce's mouth went dry. His lawyer called 40 minutes later. By noon, he'd agreed to a plea bargain to avoid trial. The hospital terminated Dr. Pierce 72 hours later. His medical license went under review by the state board. 6 other attending physicians who'd received kickback referrals from his phantom consults faced their own federal interviews. The morning Pierce cleared his office, his diplomas, his photos, his plaques acknowledging his standing in the medical community. Laura walked past in her freshly restored nursing uniform with a silver star ribbon pinned directly above her heart. She was wearing her captain's insignia openly. The hospital had issued a formal apology, back pay for the day of her termination, and a new title. She didn't break stride. She didn't acknowledge him. She just delivered that ice-cold stare one more time, waited until the silence became something he couldn't breathe through, and said 6 words in a voice that sounded like a tank idling in a garage: "You should have let me disappear." She kept walking. Pierce's hands trembled as he packed his diplomas. His daughter didn't return his calls that week. His ex-wife saw the news and changed the locks on the house he'd been paying for. 3 months later, Dr. James Pierce taught CPR certification courses at a community college for minimum wage, demonstrating chest compressions on a plastic dummy to bored students who didn't know he once controlled a surgical service. He'd see Laura's photo in the hospital newsletter announcing her promotion to Director of Emergency Medicine and turn the page before reading the article. That's all he let himself know: she'd won. He'd lost. The details didn't matter anymore. But that wasn't the end of the story. 6 months after the general's helicopter landed in Norfolk, Laura stood in her new office on the 2nd floor of Seattle General with her Silver Star citation framed on the wall beside her son's photograph. He'd video-called from deployment in the Hindu Kush, the same theater where she'd saved his commanding officer 10 years earlier, and saluted his mother through a pixelated screen, finally understanding why she'd never talked about the missing years. The pieces had snapped into place for him: the scars, the nightmares she thought he didn't notice, the way she moved through the world like someone who'd already survived the worst thing. He was sleeping now in the same mountains where she'd saved lives in the dark. She'd given him that inheritance without knowing. In her desk drawer, wrapped in tissue, was the faded unit patch Rains had sewn inside his jacket lining. The same patch her son wore pinned inside his own body armor. The patch that told her, the moment Rains had walked through the hospital doors, exactly who she was saving and why she could never refuse. She ran her thumb over the worn threading during difficult shifts, remembering the bus stop in the rain, remembering what it cost to step forward when 5 doctors had stepped away. The hospital implemented new emergency protocols within 2 weeks. Code Blue responses became mandatory for all attending physicians: no delegating, no hiding behind administrative excuses. Retaliation through disciplinary filings or scope of practice violations became grounds for immediate termination. Laura trained the entire emergency medicine residency program herself, her hands moving with surgical precision as she demonstrated field procedures on plastic models. One resident asked about the scars tissue thin across her knuckles. Laura looked at her and said 5 words: "Some wounds come from healing." On her desk sat a new succulent, thriving in the window light, positioned exactly where the dying one had been the day before her life changed. The old cracked coffee mug sat beside it, refusing replacement. When young nurses asked about her scars during shift training, she told them the truth now: some injuries come from saving lives in places that weren't supposed to exist, and the deepest ones never fully heal, but they do teach you how to care for the broken with hands that understand what breaking feels like. Master Sergeant Cole Rains returned to active duty with his hearing aids calibrated and his airway clear. His daughter sent a letter to Seattle General thanking the woman who'd saved her father when 5 doctors turned away. The letter was framed beside Laura's Silver Star. A petty officer in Virginia read about the case in a classified briefing and smiled, knowing that Valkyrie had finally come home. The Pentagon closed her file as inactive after confirming her civilian assignment was voluntary and permanent: no recall, no reactivation, just the quiet knowledge that she'd become exactly what Special Operations had trained her to be: someone who saves people nobody else would touch. Subscribe to see more stories about the ones who wear scrubs like armor and carry rank like a secret. Like this video if you believe heroes walk among us in places we don't see. Comment below with your own story of someone underestimated who turned out to be unstoppable. And if you know a nurse, a doctor, or a soldier, share this with them. Because true heroism isn't always announced. Sometimes it just stands at a bus stop in the rain, waiting for the next chance to save a life.